Chapter 11, Working with the Family. The objectives for working with the family will be to define the terms family and family systems, discuss characteristics of healthy families, evaluate the effects of mental disorders on the family system, list the factors to be assessed when working with families, describe the skills needed to work therapeutically and collaboratively with families, and discuss the issues associated with caring for psychiatric patients within a family context. Family and the recovery mode. Family members are the main providers, not only economically, but emotionally, physically, as well as a source of knowledge. Movement within the cyclical nature of mental illness involves positive risk taking. A normal family would be a functional family. They're not measured by lack of symptoms. They're not measured by the severity of the problems. They fit in the established social and cultural patterns, and they provide effective coping mechanisms. Family characteristics are that they nurture and support their members, they provide stability and cohesion, they protect the vulnerable, they provide the platform of truth for children, they provide clear lines of authority, they acknowledge each other's value, and they prepare them to cope in society. So when we talk about stages of family development, young adulthood is where separation from the family of origin without cutting off. You also have coupling, where joining of two families to create a third. You have families with young children. You have families with adolescents. You have families at midlife or empty nesters. And you have families in later life. Contemporary families. The nuclear family is no longer the predominant family structure. And that's because of divorce, remarriage, same-sex marriages, single-parent family, blended family. Contemporary families, they're culturally diverse as a result of immigration, intermarriage, and cross-cultural adoption. There's some of the new challenges that there's a balance between cultural heritage, value norms, and behaviors in the new culture. There's discrimination and racism. There's a lack of familiarity with a new culture. You could have some issues with speaking the language and also lack of jobs. Societal changes can cause stress in the families. Communication technology is being constantly aware of the world events, fear about the future, personal safety, random acts of violence, gang wars, and racism. So the family systems theory, it's a collective unit made up of individual parts. Every family member plays a critical and unique role in the system. Change in one member of the system affects the entire system. And de-emphasizing blaming a family member's problem on a specific family member. This also includes parentification, where the child is taking care of an adult responsibilities in the family. Scapegoat, where the member of the family who is seen as the blame for the conflict, the family member focuses on trying to fix the identified patient rather than the real issue. And then enmeshed, the family structure that resists demands for change and the boundaries are excessively rigid. You also have the disengaged, where members of the family are distant and disconnected. The boundaries are also excessive and rigid. And triangulation, it's a conflict between two family members and they attempt to involve a third person to take their side. So the first case study is the Smith family arrives for their first session of family counseling. The parents, Dan and Tina, 13-year-old Katie, and 16-year-old twins, Alicia and Alex. Dan and Tina, along with Alex, all voice concerns that Alicia's new popularity in high school is causing the whole family problems. Alex says, "My sister used to be this good girl, a fun playmate, but now she's out of control. I saw her kissing under the bleachers." Dan and Tina echo Alex's concerns, expressing appreciation for what he has shared with them out of concern for his twin. "We all just want to keep Alicia safe," the mother says. Asked for her take on things, Alicia, whose eyes are sad, shrugs and says, "What's the point? My twin has turned on me, and mom and dad are eager to believe the worst." 13-year-old Katie starts to cry. Alicia closes her eyes. Which role best describes brother Alex's behavior towards Alicia in this scenario? Scapegoat, disengage, triangulation, or parentification? So at this point, parentification is the process of role reversal whereby a child takes on the adult responsibility within the family. And that's what Alex is doing in this part of this scenario. But as the session continues, Katie is encouraged to talk about why she is crying. She doesn't speak within the group, but in an individual session, she later speaks. When they started their new school, Alex didn't like it when Alicia got new friends. I feel bad for him. I think he felt left out. They started to fight a lot, and then Alex told Dad that Alicia was kissing a boy. Dad got really upset and grounded Alicia. She can't do anything. "But Katie, what exactly made you cry during the family therapy?" the therapist asks. Katie ducks her head and says, "The thing is, Alicia didn't kiss anybody. I was with her under the bleachers. We were collecting pieces of streamers to make me a pom-pom, but I was afraid to stand up to Alex and Dad. This is all my fault." "So how are you coping with all this now?" says the therapist. "I just try and take care of everybody so everybody will just cheer up and be nice like before." So with the information, how might you alter your description of Alex's behavior? Would it be scapegoat, disengage, triangulation, or parentification? So with this new information, it would be C, triangulation. And this is because when there is a conflict between two family members and they attempt to involve a third person who is asked to take a side. In this case, Alex has lied to pull his dad over to his side of the conflict. In the first question about Alex's behavior, the closest description was parentification, in which a child takes on the adult responsibility. In this case, Alex was taking over responsibility for his twin. Or we might have chosen triangulation since he pulled his parent into the conflict, rightly so or not. Now, with this additional information, Alex's behavior might be more accurate, reflective of triangulation since he had an ongoing conflict with his sister and pulled another family member to take his side, based either on a lie or a misunderstanding. So, some effects of mental disorders on the family. They can experience guilt or concern over the prognosis and course of the illness. They can worry that others may become ill. They can experience shame or embarrassment, dealing with the patient behavior and the consequences, and in some cases, facing danger or dealing with law enforcement and various agencies. Some common issues would be medication compliance or side effects, lack of energy for ADLs, social isolation, acting out behaviors, mood swings, denial of illness, poor judgment and communication, um, persistence of dangerous behaviors, and manipulation of others. Some grief issues would be loss of individual function, the alteration in the family functioning, the loss of income, the stigma, and some questionable future. So we have Temitope is a 26-year-old woman from Nigeria who has sustained a psychotic depression after the birth of her fourth child. Her mother and husband are upset that she is unable to take care of the children. They wonder whether she is having a visit from an evil spirit. So how would the nurse assess Temitope's family? And how would the nurse use the knowledge of the culture to provide assistance to Temitope and her family? So it's important to realize that the cultural belief system in this family is to provide care. So you need to assess their cultural views of this illness as well as the developmental stage of the family system. You would need to provide information about the hormonal changes post-delivery and their effect on the mother's psychological being. This information may promote understanding of why she may be having these symptoms post-delivery of her fourth child. Some family reactions to psychiatric treatment and hospitalization. Some can experience relief. The immediate family may not want others to know, fearing a negative reaction. They may be exhausted and need support and relief. They may have conflicting emotions with an involuntary commitment. They may experience burnout. If abuse or assault is discovered in the family, a referral to obtain the appropriate treatment is essential. And you also need to ensure safety of the abused family member to allow confrontation of the pain and suffering caused by the abuse. The nurse's role would be to assess, listen, not make judgment, refrain from perceiving one family member or the entire family as problematic, refrain from placing blame. Family therapy is beyond your scope of practice. Family therapy is done by a professional who has been prepared at a master's or doctoral level, allowing for the complexity of issues and skills needed. And some abilities needed when working with families is self-knowledge, assessment, therapeutic communication, family psychoeducation, spirituality, collaboration, and referrals and family support. We'll talk now about nursing process and assessment. So you have family membership and development, family strengths and needs, family coping, family problem identification, and family use of resources. You also need their family strengths, an understanding of the mental disorder, current coping skills, the health issues of the patient and family members or significant others that might affect the current care needs. You also need to consider the full assessment before reaching a conclusion. If a conclusion is determined too quickly, the solution is likely not to be effective. Nursing diagnosis. They could be ineffective family therapeutic regimen maintenance, impaired parenting, interrupted family process, or risk for caregiver role strain. Some outcome identification. The goals need to be based on the family assessment. They need to be specific, measurable, achievable within an explicit time frame, under the control of the individual family members, and other agencies may be involved in the treatment process. Planning and implementation would include providing respect, empathy, support, and acceptance, advocate for the patients and the families, build self-esteem, facilitate resolution of normal developmental crises, and help use adaptive coping skills and problem solving. You also need to provide referrals for support groups and resources. You need to empower the families. You need to assist family members to validate, clarify, negotiate, and communicate feelings appropriately. You also need to recognize and cope with abuse to maintain safety of family members and employ patient and family education. For evaluation, you need to evaluate the progress towards the resolution of issues, reformulate your goals if needed, create post-treatment goals for family to work on post-discharge from inpatient or outpatient settings, and it's an essential phase of the nursing process.